Welcome to Biote, the leading innovator in precision and preventive medicine. I'm thrilled that you've joined me tonight so I can go through this patient seminar. This seminar is focused on male health tonight, and we're going to go through several aspects of male health to help you familiarize yourself with both male health, but also how testosterone and hormones interplay that. I'm Dr. Corey Rice, and I'm the Chief Clinical Advisor at Biote. So what I want you to walk away with today is, what are hormones? Should I get tested? How do they impact my body? How do they impact my day-to-day life? And what are those next steps? But also, what does the evidence tell us? What does the evidence show us about what hormones do, or potentially what they don't? So we'll go through why all this matters, what the actual data suggests, and then how you can seek out a provider to help you determine if this is right for you. So hormones matter because how we feel matters, right? As we age, we tend to get less motivation. Our energy goes down, our sex drive goes down, our performance in all aspects of our life go down. We also tend to gain weight, right? It's harder to build muscle as we age. It's certainly harder to lose fat. Our brain can get foggy. We can lose focus and concentration. We start aching. Sometimes we get up in the morning and we feel stiff, or after we work out, it takes a while to recover. So how we feel as patients, we're all patients, how we feel as patients matters every day. So when you start to feel like that, your sleep suffers, right? You get moody, you get short-fused, you lose motivation. When you lose motivation, you can get depressed. So all of this sort of interplays. And so the real question is, are you living your life to the fullest? That's the question we all have to ask tonight. So what's key about hormones, specifically testosterone in men, is these are not just reproductive molecules. It's not a reproductive hormone only. It's also a metabolic hormone. It's a hormone that helps our metabolism. When you help metabolism, you help increase lean dense mass and lose fat. When that happens, you help your cholesterol profile. So all of these things interplay. Now, sexual health is important, no question. Quality of erection, desire, these things matter. But always remember, testosterone is a head-to-toe molecule that helps us head to toe. And what's really important is, where are these things called receptors? So hormones are messengers. They deliver the message to the body. Well, within the body, we're made up of a whole bunch of things called cells, trillions of them. Well, inside of these cells, we have these little landing zones that are called receptors. What's important for you to know is, there are receptors to testosterone head to toe, and in basically every organ. So when you have good amounts of testosterone and you're performing well in your life, or you go on to testosterone replacement therapy, you're gonna find that several things throughout your body change for the better. And the reason is, you're hitting those landing zones called receptors throughout all of our cells. So the formal definition of low testosterone, or a condition called low T, or even more formally called hypogonadism. Hypogonadism is where adult men have a clinical syndrome. So this is a syndrome that's associated with lower levels of testosterone, which ultimately affect multiple organ functions and our quality of life. And the idea here is, this is obviously becoming more recognized, right? We see more magazines and news shows and doctors talking about it and things like this, but we still feel like there are a large number of men out there that are not diagnosed. And when you're not diagnosed, you're not treated. And when you're not treated, you certainly have a poor quality of life, and we don't want that. So the American Urologic Academy says men at the age of 30 and then beyond that start losing 1 to 3% of their testosterone levels naturally. So what's normal? That's defined as normal, losing testosterone starting at the age of 30. Well, what's also considered normal? Low testosterone has been found to increase the risk of diabetes. It's been found to increase the risk of high blood pressure and sleeping issues and just other forms of chronic disease. It's also been linked to early heart disease and high-grade aggressive prostate cancer. So that's important to know. It's not just about your quality of life, but this molecule tends to protect you as you age. So what tissues does it protect? Well, absolutely the brain, the bones, the heart. Like I said, wherever those receptors are, it also protects something very important to all men, their relationships. So that's their relationships at home with their spouse or with their children or grandchildren, or their relationship with their friends and coworkers. These things matter. The benefits of having your hormones appropriately optimized are extensive. That list is extensive. So whether it's improving your metabolism to help lose that stubborn weight, helping your cognition and your fogginess and potentially the depression and that whole lack of motivation, it helps with your libido and your erection quality and potentially your cholesterol and brain and all of these things. Exercise performance, which I know a lot of men that resonates with. That's what the hormone can do, and the balancing of it can help improve. Now, when you go and you find a provider that's been certified and credentialed appropriately through this company, Biote, they're going to talk about your testosterone. They're going to talk about your levels. They're going to talk about what's potentially appropriate for you. But the other thing they're going to talk about and test on you is looking at something called thyroid. So our thyroid gland is very, very important. The thyroid gland regulates many things throughout the body, including our metabolism and our weight and our energy and bone health and all of these things. So a lot of these symptoms of a sluggish or suboptimal thyroid overlap with the sex hormone testosterone. So I think it's all encompassing, and it's important that you look at all of it to see where you are. The biggest complaint I think we see in healthcare these days is weight gain. People can't lose that stubborn fat. And one of the biggest reasons that is because of hormonal imbalance, whether that's thyroid imbalance and or testosterone imbalance. So the key is getting your labs drawn the right way and the right labs, but also getting the right provider to interpret those for you. So what does the literature suggest? What does the evidence support and suggest and tell us as it relates to testosterone replacement? Well, urologists at Harvard have been clear on this. Testosterone deficiency is really more of a clinically based threshold versus any specific lab value. The point there is listen to you, the patient. What do you say? And then correlate those symptoms with the blood work that I've talked about. That's the best way to do this. Let your quality of life and symptoms really drive the conversation, and let the labs just be part of the equation when deciding whether you need optimization or not. Hormone replacement therapy, hormones specifically, have been found to influence cognition. And ultimately, men with low testosterone, believe it or not, are 3 times more likely to develop Alzheimer's disease, according to research. What about bones? We know that if you go in for a hip replacement or a knee replacement, the odds of you having to have another one in 7 to 10 years are actually fairly high. Well, when you're on hormone replacement therapy, it's been shown to give you a 40% reduction in the need to have another surgery 7 to 10 years out. That is very, very impactful. You don't want to have to keep having replacements of a joint. So hormones may be a good therapy to help avoid that. Just this year, a provider published a report in the journal called the Journal of Aging Male, or The Aging Male. That journal was a case report. That article was a case report. A case report is done on one patient. This was a male patient that had osteoporosis. Osteoporosis is the loss of bone. And when you have the loss of bone, you have a high risk of fracturing or breaking a bone. This man was found to have osteoporosis. He was placed on testosterone. He had an average testosterone level around 900 or so, and they were able to reverse completely is osteoporosis. That is powerful. So if you fear losing your bone, or you yourself have osteopenia or osteoporosis, I would consider getting your levels checked and optimized, because you might be able to have benefit there at the bone. Now, the number one killer of men and women in America is heart disease. Every 40 seconds, someone has a heart attack in this country. It is enormously costly financially to have a heart attack, both to you, but just our healthcare system in general. And so optimization of hormones, or potentially low testosterone, has been found to be linked to worsening or early heart disease. Another reason to get your levels checked. Now, what about erections? It has been shown in research that men that present to their doctor's office with erectile dysfunction, in 7 years from that presentation, so when you start having erectile dysfunction, in 7 years, 15% of those men will have a heart attack or some sort of cardiovascular event. Let me say that again. When you start having erectile dysfunction, within 7 years, you have a 15% risk of having a cardiovascular event, which could be a stroke or a heart attack. We want to prevent that. Early detection is the name of the game. So as it relates to the heart, what has testosterone been found to do? So testosterone lowers cholesterol over time, lowers LDL over time. It helps to remove fat and increase muscle. It also helps inflammation. Inflammation is the root of most medical disease, the root cause of that disease. Testosterone helps to lower inflammation. And in doing that, when you lower inflammation, you decrease plaque that's in the heart. It also increases blood flow through the heart. Those are great things to help prevent heart disease. I'm so excited to share this year, a landmark study came out called the Traverse Trial. The Traverse Trial was a trial published in the New England Journal of Medicine, but it's the highest level of evidence we have in medicine today. It was a randomized, double-blinded, placebo-controlled trial. That is the highest level of research. And what the Traverse Trial concluded was testosterone therapy is safe, and it does not increase major adverse cardiovascular events, things like non-fatal heart attacks, non-fatal strokes, or death due to cardiovascular causes. That was incredible. So please look out for that trial, because that is a good one as it relates to testosterone. Now, pellets, I'll get to what pellets are in a second, but understand, pellets are these little implantable plant-based molecules that go under the skin. Pellets have been studied in the context of fat loss and muscle gain and increasing exercise capacity. It's been found to help all of these things, including, as I said earlier, increasing bone mineral density. So all of these things are great as it relates to longevity and just living better. So how can you take testosterone? Let's say you decide you want to go on to testosterone. There are different ways of going onto it. Before I go through the different modes of administration of testosterone, let's talk about two terms. One is bioidentical, one is synthetic. Bioidentical, or what I like to say, isomolecular, or even more exact, human identical, is truly that. Bioidentical or isomolecular is a compound that is identical to what we produce as men. Synthetic, on the other hand, is truly that. It is not natural to the body. It is not recognizable by the body. It is made outside of the body. So when you give yourself a synthetic molecule, there is a possibility there for more side effects. Now, how can you as a male take hormones? Let's say you see a doctor. Let's say you decide this is right for me. I need testosterone. You do have choices. You have oral choices. You have creams and gels and shots and pellets and all of that. So let's double click a little bit on each one of those. So oral hormones, the issue there is it's hard sometimes to absorb these hormones. So you take them and they have to be metabolized through the liver. And in the body, when you metabolize things through the liver, you lose a lot of the good effects or the bioavailable beneficial effects of that hormone. So number one, absorption can be a little limited. Number two, when you take something orally, especially a hormone, it can increase your risk of things like heart attacks or blood clots or strokes. So there's certainly limitations there. And then what about those creams and gels you've heard about? So creams and gels, you can certainly rub on your body. The issue there is our skin is made to protect us. So when we rub hormones on our skin, sometimes we can't penetrate the skin well enough to get to the places in the body that matter, that help protect us. But also, many men report going on gels and creams and not getting a whole lot of symptom relief, which is where the name of the game is. So then we get into the idea of shots. Injectable testosterone can give you nice levels of testosterone in the blood, but the concern with injectables are a multitude of them. One of them is the absorption. So when you give yourself an injection weekly or potentially twice a week, you're getting a roller coaster of absorption. So the level goes up and then it drops, and then it goes up and then it drops. And that is sort of this roller coaster. Most men that I know, friends, colleagues, patients, myself, I don't want to live on a roller coaster. I don't want to do this with my hormones. So sometimes shots just don't work well because of that whole roller coaster. Secondarily, shots are synthetic. So they're not recognizable by the body like other compounds are. So you just have to know there are potential limitations and more side effects you can get with the injectable route. Now, what about pellets? Pellets have been around since the 1930s. Pellets are these small little compounds that are actually implanted under the skin, usually fairly painless. After the procedure, there could be a day or two of discomfort, but the reason why people love pellets is because the consistent release of the hormone. Plus, as a male, you typically only do the pellet procedure maybe twice a year. So the convenience factor is also quite high. But let me go back to the consistency. Pellets keep your levels very consistent, and then over time, 4 to 6 months, the levels start to drop gradually. So you don't get this up and down roller coaster sort of absorption pattern. It's a consistent, convenient way of doing hormones. So those are the ways you can choose to get your hormones, and we'll leave that up to you on how you do it. But you have to decide, do I want to have this sort of roller coaster of absorption? Or would I like to have something a little more consistent that may be a little more natural and recognizable to my body? Again, that's entirely your decision. Now, as it relates to pellets, there are FDA-approved pellets out there, and then there are compounded pellets that haven't gone through the FDA approval process. And what I want to tell you is, both of those pellets have been compared head-to-head. And what was found in a type of study called a non-inferiority study was that when you do that type of study, you're trying to determine, is one compound worse than another compound that's available? So in this case, the FDA-approved pellet's available. The compounded pellet that you can get from another sort of source was compared, and it was found to be non-inferior, which means it's not any worse than the one that's approved by the FDA. That has been published literature. So if you get a compounded pellet, it is no worse than the FDA-approved pellet. That's an important characterization. So what are the key takeaways from this evening? I don't want to spend too much of your time, but I hope that a lot of this information has resonated with you. I hope that you want to get your levels checked. I hope you want to partner with a provider who's educated on how to do this and how to sit down and have a consultation with you. Because we've learned tonight that hormones matter. They matter to your quality of life, your engagement in your life. They matter to your bones, to your brain, to your heart, to your body, head to toe. And then you will decide between you and your provider, what's the type of hormone I want in my body? That's a shared medical decision between you, again, and your provider. What's important to know is when you find a Biote provider to help you navigate through this sort of hormone replacement pool, just know they've gone through a pretty scrutinous process to learn how to do these therapies. So they have tests, both written and practical, where they actually have to treat live patients in front of an experienced provider. They learn how to interpret labs in a way that's quite advanced. They also learn how to optimize your thyroid that I talked about early in a more advanced way. They learn how to look at different micronutrients and how those micronutrients can be layered in to help you have really good patient outcomes. And they get a lot of clinical support from experts across the country that help them through difficult patient cases. Thank you so much for tuning in tonight. And we hope that you found this topic that resonates with many, many men very interesting. And we hope to see you very soon.